Thanks. Hello. Can everybody hear me all right? All right. Well, good afternoon. Thanks so much for the invite to be here today. My name is Dr. Justin Ross. I'm a licensed clinical psychologist, and I serve in the role as Director of Workplace Wellbeing for the UC Health System. So it's my job to think about programs and strategies and outreach efforts to take care of our healthcare providers, because we know that that's often an area that is neglected in healthcare. So we start with this quote: when we're no longer able to change a situation, we're challenged to change ourselves. This is a quote that was written by Viktor Frankl, who wrote a book called Man's Search for Meaning based on his experiences as a Holocaust survivor. And what's important about his work is he talks so much about the role of connection to human suffering as a catalyst to help us determine our own meaning and our own well-being. So we're going to talk a little bit about that here today. Let's see here. Uh-oh. Should get the right one there. Give it to the resiliency guy to screw it up and have to test his own resiliency in a room full of people. So just real quick, no disclosures for me to report. I want to start with this question for everybody, and I want you just to think about this. What emerges from chaos and crisis, right? And I think the work that we all do, we are struck with this firsthand with our patients when we see them go through a new disease process, and we see the impact that chaos and crisis has on their well-being and the impact it has on their family's well-being, their lives. But I want you to think about this idea for you as a healthcare professional. In your life, when you are struck with chaos and crisis, what are the first things that emerge, right? And it's probably some sense of panic, stress, dread, frustration. And by the end of this talk today, hopefully you have a new idea for some other qualities that can emerge from this condition. So quick show of hands for everybody in the room. When I say the word burnout, have you experienced some element of burnout in your life in the past few? That was really quick, yeah. So keep your hands up for a second. Look around the room for a moment and just recognize the deep humanity in what's happening here, right? It's just about everybody that I can see has experienced this. When we talk about burnout, we want to understand that there are three core areas of symptoms that occur from this condition. The first is an area of emotional exhaustion, right? This idea of just being completely depleted in mind, in body, in spirit. The second is called depersonalization, which is a kind of a fancy word for our loss of connection to other people. But we stop seeing other people through a lens of humanity, and we start seeing them as another patient or another thing I need to follow up with or another checklist item that I have to respond to. And the third is we may feel a reduced sense of satisfaction in the very work that we do, right? I've been a long believer that everybody sitting in this room is in healthcare for a very personal reason. It provides deep meaning in being able to help other people. And we lose sight of that over time when we start to hit this condition of burnout. There's a study published in Mayo last September that showed right around 63% of physicians throughout the country are experiencing at least one of these symptoms over the past few years. So we see the impact of burnout significantly high in healthcare in the past few years. When I say this word, moral distress or moral injury, again, quick show of hands here if you felt morally injured or morally distressed in the work that you do. Yeah, handful of people, a little bit less than burnout. What we see with moral distress or moral injury, it's really our connection to human suffering. And we are in the business of helping people through the process of human suffering. Moral injury can be developed in really those three bold ways. It can be your own personal experience with your patients or in your personal life. It can be in bearing witness to, so maybe not your experience or your patients necessarily, but when you see a colleague or a teammate or something within your clinic setting, also be connected to human suffering. And then the third is really this learning about, when you look out at the world, when you see or hear or have stories that connect to human suffering. These are all areas that moral injury or moral distress can develop. And clinicians in general, we do these three things typically very, very well. We have a very high value of putting our head down and getting our job done, right? We have work to do and we're responsible and we're duty-oriented. We often internalize this, and we've done this for a long time in the culture of medicine, that we are the ones that fix things. We are the ones in a position to help other people. We're not the ones that should be injured or should be hurt or should need help. We have these high levels of internalization that we're not the ones that need fixing. We're the ones doing the fixing. And so we often walk around with these struggles without really letting anybody know about them. All right, last show of hands, compassion fatigue. Who here has felt a sense of compassion fatigue in the work that you do? Yeah, and again, I'd encourage you, look around the room and just notice the humanity and the impact here. What we know about compassion from a psychological perspective, compassion in and of itself is not fatiguing. I would argue that compassion is actually highly rewarding and is a side benefit for the work that we do. It feels good to care for other people. It feels good to be a part of their healing and the recovery process. But we know that compassion can become fatiguing when one of three things, if not all three, set in at the same time. The first is a sense of hopelessness, right? When what we're working on is not going to get better. There's no end in sight. There's no light at the end of the tunnel. And we can see that in a number of different ways in the work that we do. The second is when there's a sense of helplessness. I can't change it. I can't make it better. I can't stop this, right? We don't have control. And the third is when we don't have the ability to put boundaries to separate levels of distress. And this can occur in walking from one distressing case to the next, or often what we saw through COVID, moving from a clinic setting to a highly stressful home environment. So we have a lot of compassion fatigue that's developing in our medical population of healthcare providers as well. So we have what I call two types of tired, right? And the first type of tired is the one that we've grown accustomed to talking about. And this type of tired requires rest and time off and space. And so when we often hear this, either we say it or a teammate or a colleague says that we're tired, this is often what we think about. But we don't often think about what this other type of tired requires. And this other type of tired can only be cured by having elements of peace of mind, peace of spirit, peace of healing some of those elements of moral distress and burnout. So we need to talk more about how do we get to peaceful interventions for all of our healthcare staff. The last few years, especially through the lens of COVID, there's been a lot of talk around self-care. And quite frankly, it's driven me crazy because the whole idea when you hear these conversations, it's just sort of like, if you just took care of yourself, everything would be so much better. And we know that that is so far from being accurate. That this is if you take one thing away from my talk today, this is it. It's opportunity is the starting point for well-being. Opportunity is the driver for having access to healthy food and healthy space and healthy ability to exercise, time throughout our day to stop and breathe and to meditate, right? Opportunities to connect to loved ones. Opportunity is the driving starting point for all elements of well-being. When we talk about well-being mismatches, there's three buckets of things that we see in healthcare that often drive this conversation of burnout. The one dimension is around capability, the second is around social, and the third is around the moral dimension. And as you just sit here today and you think about your workload, run your day, run your week through these three categories. In the capability dimension, the biggest drivers of burnout that we see are work and stress overload, right? We have 20 hours of work to do in a 10-hour workday. That's pretty common. And it's not just for one day. It's for weeks and months and sometimes careers. And so when this piles up, it continues to really have a detrimental impact on both our mind, our body, and our spirit. When you add in lack of control, when we don't have adequate resources, we don't have what we need to get our jobs done to be successful, it really plays in our ability to do work efficiently and effectively. The next dimension is the social dimension, and this really includes things like not being rewarded for the work that we do, not feeling rewarded for the work that we do, not feeling as though it's being recognized, not feeling as though it's adding value. When we have community breakdown for whatever reason, one of the biggest areas that we're seeing right here, right now, is in staffing shortages that are impacting healthcare settings across the country. When you start to have these social dimension breakdowns, that really starts to impact well-being as well. And the moral dimension is then this third area. As we just talked about, moral distress, moral injury is a high driver, but so too is being in situations that lack fairness or equality, or there's values conflict in being able to make decisions that surround patient care. I'm a big believer, one of my favorite sayings in the work that I do is you cannot change what you're not aware of. So what I'd actually like to do is offer just a 3 to 5 minute little practice that's a bit of a mindfulness exercise to help people get in touch with this idea. So no obligation to participate, but if you'd like to, what I'd encourage you to do is to just scoot back from the table that you're sitting at. And if you've got things in your hands, pencils, phones, coffee, what have you, just set it down. Ideal position, feet flat on the floor, arms in your lap or at your side. If you feel comfortable, allow your eyes to close. If you'd prefer to keep them open, totally fine. Just lower your gaze so it's down in front of you at the table or the floor. And just start by taking a moment to give yourself permission to do just this. This is not often a permission that we give ourselves in our day-to-day lives. Start with permission to be here in your mind, in your body. Notice how your body feels in this chair, in this room, in this moment. Notice how your feet feel on the floor, or how your legs and back feel supported by the chair. Notice points of clothing or jewelry on your skin. Take a moment to find your breath. Notice wherever it is that you can feel your breath. Perhaps that's in your nose or your throat. Perhaps your lungs or your abdomen. And just be reminded that with breathing, there's always two things that we have access to. The first is awareness. Just as you're doing in this moment, awareness of how your breath feels. The second is of influence. Notice your ability to deepen your breath, to slow your breath, to focus on your breath. And notice that the impact that that may have on your sense of well-being right here, right now. And then last, just take a moment to expand that awareness so that you can get a sense of your mind, your body, and your breath all here, all available at the same time. You don't ever need to go too far to connect to any of those experiences. But just be reminded at how quickly we shift away, focus on our to-do list, our next patient meeting, and how infrequently we stop and give ourselves permission to do something just like this. So whenever you're ready, you can just slowly start to bring yourself back to the room. Maybe give your body a little movement. Stretch your arms, your legs if you have to. When you're ready, open your eyes. I can feel an energy shift in the room pretty quickly in doing that. That was 4 minutes. And the reminder here is, again, from an opportunity perspective, none of that was challenging or hard. But what's hard or challenging is giving ourselves permission, finding space, finding opportunity to actually do that in our day-to-day lives. The framework that I typically use when I talk about how we do this as healthcare providers, we have these 3 buckets of skills. The first skills are around resiliency. And just like burnout, resiliency has become a worn-out phrase in the past few years, right? We know that resiliency is sort of time-limited, right? I have this goofy idea, right? If this building caught on fire, I'm not going to ask anybody to become more flame-resistant, right? I'm going to say, let's get out of the building. Let's get out of here quickly, right? Resiliency is the ability to have what it takes to get out of the building when you're in the middle of distress, right? So that you can survive and that you can move on. Now, the hard part about resiliency skills as it works for healthcare providers is every single day we're going into burning buildings. It's the call of our jobs. It's what we do. So we need to be armed with these skills. We also need to have skills around healing, right? Healing is the opportunity to, once we're out of the building, stop for a moment, to do a deep dive, to check in. Am I injured? How did that feel? What did I notice? What am I experiencing? We have to have this conversation around acknowledging that what we go through is deeply impactful for us as human beings. We have to be willing to have that conversation for ourselves and for our colleagues. The last is what we call growth, and we know that there's an element we call post-traumatic growth where we can actually grow and have positive psychological change because of adversity, challenge, and trauma. Real-time resiliency is a set of skills that I often teach. That's very simple, just like mindfulness, just like breathing. It's not hard to do this, but it's hard to remember to do this. Real-time resiliency, it's a skill called hardiness, and there's research that supports that doing this is the wedge between compassion fatigue and what we call compassion satisfaction, which is a protector. It's an anti-burnout strategy for maintaining your connection to the work that you do. There are three things in this process. The first is really around commitment. And sometimes it's a micro commitment. What do you need to do right here, right now? Right? What does your patient require? What's the next thing on your to-do list? What's the very next step you have to take? Can you be 100% committed just to that? The second is embedding some elements of control, right? Having control throughout your day to stop, to breathe, to take space, to reconnect, to understand how you're feeling is really important in this process. And the third is embracing a challenge-based mindset, right? Mindset is another word that gets thrown around a lot. And the truth is you can have any mindset that you want. You just have to be clear about what it is you're trying to develop. A challenge-based mindset helps us recognize that what we're doing is a growth-oriented opportunity. It's not a threat. It's not a threat to who we are as providers or as individuals, but we view it through the lens of challenge, right? It's challenging our education, our understanding, our ability to be present or to deal with adversity. When you start to wrap those skills together, it really becomes a buffer for anti-burnout. All of this comes from trauma-informed medicine, which is the recognition that when we're working with patients, we think about what they're going through and what they're experiencing rather than what's wrong with them, especially from a psychological perspective. Now, medical professionals aren't very good typically at doing this for themselves. We are very good at judging ourselves and blaming ourselves. I should be stronger. I should be able to handle more. I shouldn't be bothered by this. This shouldn't impact me as much, right? We layer ourselves with these should statements of how we should be able to just carry on without any impact. So we need to change the conversation around a trauma-informed perspective to recognize that the work that you do is going to be deeply impactful to your psychological well-being, and we need to develop strategies to help you manage and succeed. Post-traumatic growth is this evidence-based practice now that we utilize to think about how do you take adversity, challenge, and trauma, and how do you impact it in a way that can encourage your own development. Caveats to this approach: it doesn't mean you have to approve of any of the experiences that you've been through. It doesn't mean you have to like any of the hardships or any of the difficult cases that you've had or the tough decisions you've had to make. The idea of post does not mean that you're past it. In fact, any distress that you're feeling is likely going to continue with stress, anxiety, burnout, moral injury. It can be challenging, disruptive work because at its core, it requires that you look at how you've been impacted in the work that you do. And it is a process more than an outcome. We do have some data on this. A lot of the data has emerged from providers working through COVID. Here's one study that I'll just cite briefly. It's right around 12,000 plus nurses, over half working in COVID-designated facilities or units. The reported symptoms of PTSD are arguably low in this study. It's 13%. If you look comparatively to nurses responding to SARS on a global level, that number is more like 1 in 3. So we know that medical PTSD for those providing care is a real thing, estimated at about a 1 in 3 level. So if you look around the room, just about every 1 in 3 of us have experienced some medical trauma that could be very impactful to our sense of well-being. A meta-analysis that really looked at how we best go about this, combed through 46 articles, and you can look at some of the bolded words here that really stand out. Awareness is critical in your own well-being. As we stated at the beginning, you can't change what you're not aware of. That's a critical foundational aspect. And then really having training and support around this process is absolutely vital to maintain our sense of vitality as a healthcare professional. The steps here are really straightforward. With about 80 seconds left on the clock, I'm going to go through this very, very quickly. The first is around education and understanding. And one of the reasons I think maybe the most powerful part of a conversation like this is at the beginning when everybody raised their hand and said, yeah, I've experienced some burnout too. We have to start all of this from an understanding that none of this is a sign that something is wrong with you, that you're lacking resiliency, that you should be stronger. It's a sign that you're a human being and the work that you do is going to be deeply impactful. So these are universal concerns that we see in healthcare. We have to have strategies that arm us towards psychological regulation, our ability to calm ourselves in mind, body, and spirit every single day. Safe disclosure is the ability to really have people that we can share these experiences with that are going to understand it and not just minimize it or take it away or say it's not so bad or it's going to get better. We need people who are in the trenches with us who can really understand on a deep level those impacts. We need narrative development to help understand how this fits into our life story as professionals and providers. And then we often have these changes with service, purpose, and meaning. The very core of what matters to us can change. And it looks like these things. So this will be the last slide. I'll go through it quickly. The benefits of a post-traumatic growth approach are really understanding our personal strengths, right? Nobody gets through hard times without having personal strengths to draw upon, and so we can have reflection of there. What do you do to take care of yourself when times are hard? The second is it can bond relationships in a really positive way. It's often through really challenging adverse circumstances that we develop close relationships with our friends, our community, and other providers. We can have increased appreciation for our very lives. We're around ill people all the time, and I know for me personally, my takeaway every day is I'm so grateful to have my health and my ability to connect with my loved ones. So that increased appreciation can be really powerful. New possibilities for who we are, what we're doing, what we want to accomplish in our lives can emerge. And then last but not least, there can be this spiritual development that happens for us as well. I'm going to click all the way to the end here. Just as a thank you, my wife is having surgery on Monday for an ADH diagnosis. My sister-in-law is going through chemotherapy for carcinoma. So from a personal level, thank you all for the work that you do. It's profoundly impactful. I don't think any one of us doesn't have a personal story about being impacted by cancer. So from a personal level, thank you. If anybody has questions or wants to reach out further, there's my email address. And with that, I'll leave you. Thank you so much.